So pelvic ureter runs on the lateral wall of pelvis in front of internal iliac artery. So the image is not present here, so internal iliac artery. So pelvic ureter runs on the lateral wall of the pelvis in front of internal iliac artery. So the internal iliac artery is actually, so there are two main types of artery, external and internal iliac artery. And external iliac artery is actually, let me draw the image. So this is IVC, and then we have aorta. So the internal iliac artery, so common iliac, if I draw here, and then divide into external and internal. So if we talk about external iliac artery, is running behind the ureter. So pelvic ureter run on the lateral wall of the pelvis in front of, so ureter is running front, in front of internal iliac artery, internal. So it then runs forward and medially to enter the bladder. So we have bladder here. So ureter is in the pelvic part of the ureter is running anterior to internal iliac artery. Then it moves forward, enter into the bladder. It passes obliquely through the wall of the bladder for 2 centimeters. If we talk about the blood supply of the ureter, proximal 1/3. So if we take proximal 1/3, middle 1/3, and then inferior 1/3. So proximal 1/3 is supplied by branch of renal artery. Why this is important? Because when we deal with renal transplant patient, this portion of the donor anatomy is used to establish circulation with the new kidney to the recipient bladder. So, and we usually take left kidney because renal artery of the left kidney is longer than the right kidney. So usually the left kidney is taken for transplant, and proximal 1/3 is supplied by renal artery. We usually take left kidney. The distal part of the ureter receives blood supply from aorta and iliac artery, and sometimes it can receive branches from gonadal and other visceral arteries too. So there are 3 sites of ureter narrowing. This is important clinically. So ureter narrows at 3 sites: pelvic-ureteric junction, at the pelvic brim, and at ureteric side. And at the ureteric orifice, this is the narrowest of all sides. And this is the most common site of stone too, where stone can dislodge. Most commonly. So this is all about ureter.